As more Brits turn to social media for advice on cut-price cosmetic surgeries abroad, the government is enlisting the help of medical experts on TikTok to warn about the dangers of these procedures going very wrong.
Well, Sarah Platt suffered a botched surgery in Turkey that left her badly infected and in excruciating pain. Well, Sarah joins us now alongside plastic surgeon Professor Ian Whittaker, who played a big part in saving Sarah's life. Good morning to both of you. Thanks for coming in to talk about this. And Sarah, I know for you, I'm sorry, because it's just a horrible ordeal that you've gone through. And obviously this is a very personal thing to talk about, isn't it? But you do want to be here to warn others.
Yeah, definitely. I'll do whatever I can if it saves another person. I'll put myself out there. Do you mean I'll show, my scars, my body openly to the whole public, the whole world, if I have to, if it's going to save one more person. Do you mean I'll take all, the bad comments or whatever, and, I use that to try and save another person, and that's, main thing.
Can I see how this happened? Look, I mean, there'll be people out there going, well, hang on, you went to Turkey, you should know what the dangers are. But just to be clear, this all started because you had a gastric band operation there. You lost a huge amount of weight. That was an operation that, for you, went well.
Yeah.
This was the next step. It was the cosmetic step.
Yeah.
As a result of that surgery, you had loose skin, etc. But help us understand why you chose that particular hospital and what it promised to you and what it under-delivered.
So I researched in the UK, couldn't afford it, there was no way about it. Do you mean I'd gone to the NHS and asked them for help? I had constant skin infections. So I started looking further afield.
So the NHS wouldn't help you?
No, they couldn't, because obviously it's the funding and everything, even though it would have probably been, cheaper now, in the long run. And, I was desperate. I had constant skin infections, constant bleeding and everything like that. So I started looking further afield. I flew out a year before, and I, went and looked at 8 different surgeons and clinics and, hospitals. And, I seen all the certificates. I asked them the right questions. I'd done my research, and, I picked my surgeon. He had a YouTube channel. He had all of this, amazing stuff, amazing reviews, 5-star rated, and it still happened to me.
And when did you feel, when did you kind of think, oh no, this is not going well?
As soon as I woke up.
Was it? So you didn't kind of think anything, you were just like, I woke up.
And
what happened when you woke up? You were in pain when you as soon as you
in the
woke up?
morning, they rushed me to the, they picked me up late, rushed me in the hospital, sign forms. Do you mean? And that a lot of the time happens to a lot of, the patients, and you don't realise, you just think, oh, they were late picking me up, and, that I think that's when I started feeling like a bit, and...
So that was the warning sign. This is the thing, you weren't influenced by TikTokers or anybody else. You did your research, and it looked OK until you arrived, and then there were warning signs. There were red flags. They got you to sign things very quickly in a foreign language. There was a moment that I read, and I was staggered as you woke up and you were in such pain that at one moment you had a family member there. And just describe what you said.
I was asking them to kill me. I couldn't deal with it. I can still feel the pain, though. I can still feel the pain, and this is what people don't realise. It's not just about the scars. It's about the mental health side. It's about how it changes your family, how it changes your future, it changes your life.
Right.
It changes everything.
And you were supposed to be able to go home fairly soon.
12 days.
And what did it mean in
I was left rotten in a hotel room for 28 days. So it was quite a significant change, do you mean? And then when I got home, I was falling to pieces. I looked like a jigsaw puzzle.
But on top of that, they do the first operation under anaesthetic. The next one they do, you're awake.
Yeah, it was horrendous.
Right.
I was screaming.
My goodness.
Yeah.
And you came back to the UK, and it turned out you had life-threatening infections. It got to the stage, didn't it, where your family were warned that you might not live through it.
Yeah, and unfortunately, and all I wanted to do was hug my kids and see my kids, and I struggle still. I'm a totally different mum now. I wasn't allowed to see the children because of the infection, because I had MDRO and septicemia, so I wasn't allowed to see my children. And me thinking, oh my God, 3 days I might not be here, was horrendous.
It's so shocking. And you've had to go through a series of operations, haven't you, to be able to sort this out? Professor Ian Whittaker is one of those surgeons who's helped with this. What was your reaction when you met Sarah and she was in your care, when you saw what had happened to her?
So I remember seeing the initial photographs that the general practitioner had sent over, and I knew immediately she needed to come straight into hospital for specialised care. my first thought was, you know, she was a vulnerable patient who was incredibly unwell, and we just needed to do the immediate life-saving measures, you know, to remove the infection, remove the infected skin, and it was the whole NHS team. Clearly, it wasn't, you know, just me. It was surgeons, anaesthetists, nurses, etc.
Just help us understand, how botched was this initial procedure? What are we talking?
I think it's very fair to say it was a poorly conceived operation in terms of...
Well, that's doctor speak, but I mean...
Yeah, she had too much altogether at the same time in different areas. Right. She clearly wasn't warned of the risks, and I don't think the patient selection and discussion was appropriate. So, yeah, this, in my opinion, would not have happened in the UK.
No. And not only would it not have happened in the UK, you would expect, I would have thought, a doctor who conducted such an operation without consent to have been governed by the regulatory body and disciplined.
So that's a hugely important point you make, and there is much stricter regulation, you're exactly correct. And the aftercare clearly would have been completely different. Right. As soon as she woke up, would have known if she was in too much pain, would have given her pain relief, and she wouldn't have had a second operation to look anaesthetic.
What's your message, Professor Whitaker? You know, you are a plastic surgeon, you're part of an organisation.
Yes.
And many people are going to the sun to have these operations.
Yeah.
You know, we've now got the government working with TikTok to say, stop all this. Yeah. What's your message as an expert that sees what happens when these things go wrong, as a significant percentage of them do? Do you know the percentage?
No, we don't know exact numbers, but we can see an increasing number coming in, you know, to the UK. I'd say the lowest price can often be at the highest cost.
Right.
And even if you do your research like Sarah, I think it's very difficult to know where is safe to go, and the quality assurance that you touched on, it's just not there, and there's no aftercare. To me, that's the most important thing. There is no aftercare when they come back to the UK.
So don't do it.
That'd be my message, but obviously it's important to say there are some good surgeons in Turkey and some good facilities, but it's rolling the dice, in my opinion.
OK. Well, Sarah, what do you make of this campaign, then, of the government trying to prevent, or, you know, to discourage people from doing this?
I think it's too little, and I also think the government need to use people like us, people that have been through it, people that, you know, can show... Because, like, on cigarette packets, on alcohol, there's warnings. Why is there none of that on surgery? They just show this amazing body, and they need to be showing the risks. They need to be. People need to know the risks.
So what would your advice be then? You know, if someone sitting at home right now is looking at, you know, what operations they could have, is planning something, what would you say to them if they're thinking of going abroad?
Stay in the UK. It's not worth it. It's not worth it.
Right. And across the cost of to the NHS as well. Repairing what happened to you. Sarah, you know, part of the way people engage with TikTok, or why they respond, is because there's an emotional connection. Now, I just wonder, you know, given what you've been through and how you're sitting here now, what does it do to you to think about what happened to you? And
breaks my heart. It destroys me. It destroys me. Like, I go onto social media and, you know, try and act this brave person because I want to be there for other people. Do you mean? But in my bedroom, when I'm looking in the mirror, I absolutely hate myself. Do you mean? And that's because what they've done to me. Do you mean? But I will try and be as strong and brave and everything if I can save another person. I need to show people, you know, don't give up, don't do it. Do you mean? We will get through it.
Well, and that starts today. Now, the company Sarah used to book the surgery told us all of the accusations of Ms. Platts are not true, and we deny all of them. They go on to say that it's important to clarify that we are not a hospital or medical provider. We're an independent entity that facilitates connections between patients and qualified health providers.
Just to say, if you have been affected by any of the issues we've been discussing, you can find advice and support at itv.com/helplines. Thank you both for coming in, and thank you for talking about it. I know it can't be easy, so I really appreciate it.